Hi everybody, thanks for watching my gastric sleeve video tips for hospital. My name's Emily, I'm post-op 6 days. If you don't already know me or if you haven't seen my videos before, I'm from Melbourne in Australia and I've done heaps of pre-op diet videos and roughly 5 or 6 post-op videos. Anyway, just going to run through some quick tips today for people who are going into hospital because some people have never been in for surgery, so I wanted to send some quick tips and to update people on things like medications and that kind of thing. So stick with me and subscribe if you want to keep up with my gastric sleeve videos because I would love that. Okay, so tip 1, pay attention to your drug schedule. Stick to it. Sometimes the nurses forget and you need to remind them, especially if you've got nighttime staff. You need to call that buzzer. That is what it's there for. Make sure you stick to your schedule because if you don't, you'll get sore, basically. I'm reading off a list, sorry. I had to write it down because there is a ton of notes right here. Be specific with night staff. Sometimes they're from agencies, they may do things differently. Had a couple who were from other countries and they did things really differently. But stick to your guns, be kind, but explain what you want. Ask for metoclopramide once you're off the drip, if you're nauseous. If they offer you something called ondansetron wafer, please just do yourself a favour and do not take it. It is disgusting. I know the sound of wafer sounds like you're going to get like an ice cream sundae, but it's not good. It's a dissolvable piece of tablet that you put under your tongue. Kind of tastes like if you chewed up a Panadol. It's quite disgusting. Don't accept it. They are foul. If you have to have them if they don't have metoclopramide or if it hasn't been ordered for you specifically by your surgeon. Just swallow it. Nurses take it for hangovers. It is awesome stuff, but you can just swallow it like a tablet. You don't have to let it dissolve under your tongue. Because once you're off the drip, they can't just inject you with ondansetron, which is the anti-nausea stuff. And with gastric sleeve, you will get nauseous, trust me. Your sleeve, so it's called a bougie, what they put inside your sleeve. It's like a piece of garden hose. It's about, regular garden hose width. You can actually swallow pills. It is big enough for you to be able to swallow them. You just need to sit up. If you have something like a Panadol or Nurofen that might be a bit harder to digest, just make sure you're sitting up so that you don't sort of vomit and things like that. What else? Oh, don't stress too much about drinking liquids while you're on a drip. As I said in my last video, some people have been told to shot water every hour or something. You don't need to be doing that. You've got a drip on you for, I think, 3 days. Well, I had one on me for 3 days because I was in hospital that long. Practice swallowing liquid after the first 24 hours, but don't overdo it. You will get a really crazy dry mouth, but even if you just wet your mouth and spit it back out, it's going to be a lot less painful. You're not going to vomit, all of that kind of stuff. Just go slow, take it easy. Walking is the biggest thing. As soon as you can, walk around the hospital ward. The nurses don't care, they encourage it. They were awesome for me. Even if you're in your PJs with no bra on and they can see your nipples, they don't care. Just go and walk because it will get the gases out of your shoulders. Talked in my last video about shoulder tip pain. That's why I'm wearing my trusty heat pack. But go walking. Trust me, they do not care. They love you being up and walking around. Even if you're in your pajamas, just go for it. It will help you feel more normal. It will help you heal quicker. It will help with all of your shoulder tip pain. What else? If you have visitors, don't feel embarrassed if you fall asleep. They're going to know if you're tired. They'll be happy to leave you alone. they'll see you drop and they will want to leave. Tell at least 2 people you're going in for surgery. You need support and you need comfort in hospital. Bring enough clean undies, pyjamas, a soft toy. I had a soft toy seal, which I don't have next to me, I normally do if I'm in a bed. My soft toy Shelly. It's really comforting to have a soft toy with you, so bring one with you. I brought an iPad with some comforting films on it and TV shows. I didn't feel at all like reading, so it's really good to be able to zone out when there's nothing on TV in your room. Shower every day. Even if you have to bring your drip stand with you, it makes you feel way better. Bring your own things like shampoo, conditioner, body wash, face wash. Even in private hospital, I had to ask for a bar of soap, which, you know, I thought was a bit dodgy considering how much money I was paying to be there. But bring your own stuff. It'll make you feel better. Don't have the shower too hot also because it makes you dizzy. And make sure you are holding onto the railing because it also helps you deal with dizziness and that kind of thing. Really sorry I'm going super fast. I have to leave the house in less than a minute, so I'm trying to get through these in time. Don't be shy when it comes to nudity. Nurses see it every day. If you need help, they're not going to care if they see your boobs. They're not going to care if they have to pull your arm out or pull your pants up and down. Like, they don't care. They're trained to do that. They see vaginas and boobs and dicks every day and bums. They do not care. Trust me, my mum is a nurse. A body is a body. She does not care. Okay, so don't be embarrassed about that sort of stuff. Do things like getting up, brushing your teeth. Do as many sort of normal things as you can. Walking, brushing your teeth, having showers, brushing your hair if you have hair. I don't have much. I don't brush it, but bring a hairdryer if you want to. Doing normal things makes you feel more normal. Be kind. That's an important one. Be kind, get to know your nurses. Even if it's just their names, they really appreciate it and they'll treat you well if you show them respect. They're there to help you, but they're not there to be your slaves. You know, this one nurse I was saying had to deal with a woman who was upset because the cup of tea she'd been brought didn't have enough milk in it, and then she'd said, you know, oh, it's too hot, I need more milk, and then she put milk in it for her, which wasn't even her job because they have orderly staff for that, and the old lady had said, oh, it's too much milk now, it's cold, and to which the nurse said, well, I didn't go to nursing school to make you cups of tea. And then she ignored her for the rest of her time that she was there and sent other staff in to deal with her, because that is pretty rude in my opinion, and nurses deserve more respect than that. Drugs I'm on now. Okay, this is a good one. It is called Targin. Targin. Just ripping off the label so you can see. Called Targin. Can't really see it, but this is a slow release endone. The only difference is you only have to take it every 12 hours and it won't make you constipated as much as normal codeine does. Gastric sleeve surgery, you're going to have trouble swallowing. This stuff is awesome. I had it for my endo surgery. It helps you sleep. It makes you feel not as drowsy as endone, and it's really good if you're someone who's naturally constipated. This stuff, metoclopramide, comes in this little bottle titled Pramen. This is anti-nausea. It is awesome. This stuff I already had at home. It's 40 milligram of Somac, S-O-M-A-C. It is to protect your stomach lining from medication. Get some of this if you can. It's not 100% necessary, but if you've got a brand new stomach, you might want to use that. And then I've got my Panadol in a little Tupperware container, which you will need to be taking. Some things I also brought with me are these squishy little earplugs. They block out a lot of noise in the hospital, which you will probably love to have when you're in there, because nurses have a habit of talking right outside your door. And other patients have a habit of not closing their door when they're talking about disgusting things right across the hall from you when you're trying to sleep. Blistex. This is just your lip repair. Really good. Hospitals have aircon and heating on all the time, so it gets mega dry in there. I didn't bring it with me, but there's this stuff you can get called Fess. So it's Fess. It's like a nasal gel you can put inside your nose. My nose got so dry in hospital, I started getting a lot of blood in there. So get some Fess. My lovely princess eye mask. Make sure you got one with a dark backing. Hospitals are quite bright places and getting sleep is really important. And I am taking Women's Multi once daily. They are huge, but you can cut the tops off and mix them into like a smoothie or juice or something. You can't really taste it. If I swallow these whole, even when I haven't had surgery, they make me really nauseated. But I did it this morning and I'm fine. And I feel really energetic, which is awesome. I think that's all for now. Let me just check my trusty list. Ooh, low battery. Okay. So I'm on liquids till Tuesday, then I'm on purees for weeks 2 and 3, and then weeks 4 and 5 I'm on soft foods. You'll know your body. A lot of us are here because we don't know when to stop eating, but trust me, it hurts when you eat too much and you'll know when to stop. That's all I have to say for now. Thank you so much for watching, and please subscribe if you liked my video. Sorry, I was talking way too fast, but it is fantastic to feel like I have some energy. So bye for now, and thanks for watching.